Hello and welcome everyone to our panel session titled Growing Surgical Volume and Market Share in the Midst of Financial Constraints. I am Molly Gamble with Becker's. Thank you very much for joining us. In today's dynamic healthcare landscape, hospitals and surgical centers are facing the dual challenge of expanding their service offerings while navigating tight budgets and financial pressures. Our panel of experts from MultiCare today will discuss innovative strategies and practical solutions to help institutions not only maintain but grow their surgical volumes and market share, even when resources are limited. Now, let's get started today by introducing our panelists. With us, we have Matt Shearer, CFO of MultiCare Tacoma General Hospital, Alan Moore, and Mary Bridge Children's Hospital. Dr. Laila Rashidi, Medical Director of Colorectal Surgery and Program Director of Minimally Invasive Surgery with MultiCare Health System, and Alden Bishop, COO of MultiCare Tacoma General Hospital and Alan Moore Hospital. Panelists, welcome. Thank you so much for joining me today. I'm really looking forward to this discussion and learning from each of you. Before we dive into the topic at hand, let me turn to each of you and ask to share a bit more about yourselves and your roles with MultiCare. Matt, let's turn to you first.
Hi, thanks for having me, Molly. As Molly said, I'm Matt Shearer, Chief Financial Officer for three of our hospitals. I've been in healthcare for 15 years and healthcare finance, and look forward to sharing some of the things that we're working on at our hospitals here at MultiCare.
Thanks, Matt. Dr. Rashidi, can we turn to you next?
Yes, thanks, Molly, again, for having us. This is great. So I'm Laila Rashidi. I'm a colorectal surgeon at MultiCare Health System, also the director for surgical oncology and colorectal. I've joined MultiCare around 2019, and it's really been fun to see the growth rate, what we've achieved, in all specialties. So hopefully we'll dive in more to it today.
Yeah. Can plan on it, Dr. Rashidi. Thank you very much. And Alden, let's hear from you.
Yeah, and I'm Alden Bishop. I'm the Chief Operating Officer of Tacoma General Hospital and Alan Moore Hospitals. And I have oversight of Periop for what we call as West Pierce. We actually have 4 operating sites. That's Tacoma General, Alan Moore, Baker Day Surgery, and then our Gig Harbor ASC. I've been with MultiCare for 5.5 years. And prior to that, I was down at Ochsner Health System in New Orleans. And it's been a great journey. Through COVID, we'll talk about some great things that we've been able to continue to sustain through COVID around robotic surgery. So looking forward to our conversation today.
Perfect. Well, thank each of you. Let's get started. I think, as I indicated in the introduction, health systems like yours are facing so much financial instability today. They've got rising costs, workforce shortages, rising inflation. Can you tell us a little bit about your surgical program to start and how these financial pressures have impacted MultiCare Tacoma General? Matt, I would love to turn to you first here for your initial thoughts, and we can check in with your co-panelists and see what they would add.
Yeah, thank you. We've really focused, beginning of last year, January of 2023, we focused on 3 specific areas from a financial recovery standpoint. We looked at what our biggest levers were, and our biggest levers really were identified as length of stay, labor management, and surgical volume growth. And so we focused on these 3, knowing that this is where our biggest opportunity was. There's so many areas we can focus that we really tried to keep our window of focus tight, and we're really consistent with our messaging to our frontline leaders that these were the 3 areas that were going to be our biggest financial turnaround opportunity. And so as we look through our how we performed in these 3 metrics, if you look from 2022 to 2023, our surgical volume actually increased by about 30%. And we also have a slide that our length of stay was down significantly from 6 to 7 days in 2022 and 6 days at the beginning of last year down to 5 days. And so these have been some of our biggest areas. Labor management was another that we focused on, and we were able to reduce our agency costs by about 50% with the combination of less physical staff, agency staff, and lower hourly rates. And so we made great progress. And I'm going to focus today on the surgical volume piece, just on how we've really made a difference there. And if we look how Da Vinci in particular was a component in growing our volume and reducing our length of stay, the biggest thing with Da Vinci is that our volume and market share growth has increased as we've increased our Da Vinci platform utilization. So looking at our Da Vinci, our percent of cases from open soft tissue procedures, you can see the increase is pretty drastic from 2017 to 2023. We're up to about 64%. And so what we've seen is that with Da Vinci, we've seen more volume growth and market share growth, and it's really been a market differentiator to have robotically assisted procedures. It also has helped our contribution margin on a per case basis, partly because it's driven commercial payer mix. It's what the patients are demanding. It's what our providers are demanding. And really from a provider engagement and recruitment and retention standpoint, it's been really important to have the robots in our force. And looking at some of the KPIs for the Da Vinci program, like I said, overall, we've seen about a 30% increase in our total volume case, and that's just year over year, so from 2022 to 2023. But in the last 5 years, our Da Vinci, in particular, volume growth is up 172%. So we've definitely seen a significant increase in our volumes. And looking at the fleet that we have, we've grown significantly in the last 7 years, going from really just the Xi robots, but more recently the SP, the Ion, and the DV5. And so we've seen significant increase, and it's been really powerful to have the robots in our fleet.
Mm-hmm. Thank you so much for that comprehensive overview, Matt, and the comparisons and the KPIs. I really appreciate your remark about keeping a tight window on what you wanted to focus on. Dr. Rashidi, when it comes to the provider engagement piece, is there anything you wanted to add to Matt's remarks there?
Absolutely. I think, one of the important things we, especially with a Da Vinci surgery and the cases we do, is the education. We came in and not everyone knows. I mean, it's interesting to see how patients know more and more, and they're demanding when they come. But it's also educating, our referrals, educating, others, and especially, having this relationship with your hospital administration and showing the value of what this tool can do with patient outcome. And I feel this was one of the very strong aspects we had at MultiCare, that collaboration between the surgeons and the hospital, leadership, to do the education and work together to grow the program.
Mm-hmm. Alden, I'll turn to you now if I can, because I think as these slides show, we can see the program has experienced rapid growth over the last 5 years. And the data we're seeing here, and from what you shared with me too, I understand there's a highlighted link between the increased minimally invasive surgeries and financial viability. If we can take a step back to the beginning of this journey, let's talk about those early days. What compelled you to invest in Da Vinci surgery? What data really helped you most to validate where precisely to invest? And then if you can, point to what surprised you the most.
Absolutely. Thank you, Molly. So when we began our journey in 2018, we knew that robotic surgery was here to stay. This wasn't just a fad. It was truly midstream of the entire robotic surgery program. And so what we identified is that we had severe access issues to our robotic platforms. Our patients were waiting twice as long to have a robotic procedure as they were to have an open or a lap. Our surgeons were demanding it. So it was really great to see that there was opportunity in the market. And a little bit later, we'll talk about specifically around the work that Dr. Rashidi's been able to do around our colorectal program. But early on, Intuitive and I, we had a vendor relationship, right? We were the customer, they were the vendor. I would get frustrated when their reps would be in the ORs talking to our surgeons without me knowing it. And then I would get a letter from a surgeon talking about how we need to acquire an additional robotic platform. And Dr. Rashidi's smiling because she knows that's how it used to be. But now we're actually partners. And so we have a data export directly to Intuitive. So it's their MACA team, market access and custom analytics. We're able to leverage the entire Intuitive analytics team to help us look at opportunities in the market, really strategize and partner. If you go back to the previous slide, you'll see in 2018, we had a couple of SIs in our fleet. And looking in 2024, we have multiple XIs that we've acquired through whether it's a straight up capital purchase, a lease acquisition, or through the AMP program, which we'll talk a little bit about later on. We have an SP, the single port. We have an ION for our interventional pulmonologist. And then Dr. Rashidi was really instrumental in getting one of the first 10 in the U.S. DV5s at Tacoma General. And so we're really truly partners. So we're a medium-sized regional health system, and we're able to leverage all of the great things that Intuitive has, whether it's helping retain surgeons, recruiting new surgeons to our program to make sure that they're the right fit for what we're trying to build. And what I really like about this slide is in 2020, obviously COVID impacted all of us, both financially and surgically. And we had a statewide mandate from the governor eliminating our ability to perform elective outpatient procedures. And you can still see that growth year over year through multiple COVID waves, ultimately to where we're at in 2023 and even further in 2024. So it's really been a great journey. As Matt mentioned, we've been able to reduce length of stay, improve our efficiencies, so we're able to perform more surgeries with the same amount of resources. We're heavily bottlenecked by anesthesia. And our nursing workforce, actually, we've done a great job of retaining that team. And we've had minimal turnover throughout those years. So it's really been a great investment as an organization to continue to grow our robotic procedures.
Thanks, Alden. I'm going to turn to you, Dr. Rashidi, because there was mention there of more of a story to tell around colorectal surgeries. And I think we saw a bar graph there for a moment that we might return to. Is this something you can share about the early days of the investments in the program getting off the ground and more in its developmental stage, and then what you've seen as the results, especially about this specific procedure?
Absolutely. So I'll start from a little beginning. You know, when I joined, colorectal in general we weren't very busy. You know, it was mostly patient that we would just see through the emergency room. There was not a true like colorectal department. And, you know, and when I looked at the map, I'm like, there's so much opportunity here, you know, that we can grow. And that's what we, you know, strive for and work with our team, you know, to do. And I started, you know, doing these cases, you know, with a Da Vinci, and the education that I mentioned, it actually started from there, from our people, you know, the OR staff, from the hospital leadership, but also through our referrals. So as more we saw the increase in our volume. And this is, you know, when, and we were trying to grow also our cancer program. So this is kind of showing that we looked into it, you know, we had one system, as, you know, Alden said, an SI and an XI. And we didn't have enough. We didn't have enough tools to do the procedures that we want. So what we did, we actually worked with the MACA marketing team and our hospital to look at what is the wait time for these patients. To me, you know, I feel like any patient should be treated just as your own family. And how long, if someone has a cancer, needs to wait to get the cancer out. So we actually capture that data to see when we see a patient for our benign procedures and malignant procedures, how long our patients are waiting, right? And you can see, you know, the blue bar shows the laparoscopic and the orange bar shows the robotic approach. And you can see what the wait time was. So if you want to grow your program, number one, I would say it's for patient care. Like, when do we take care of these patients? How soon do we, and how long are we waiting? But also, if you want to grow, you can't wait this long. So that's what we presented and worked with the hospital leadership to see, is this right? You know, and this is all objective. And when they looked at it, I think all of us were surprised. I was surprised to see how long we're waiting, you know, to, you know, operate. It was at least twice as much of what we were doing open and laparoscopic. And if you have a better tool, which we're later going to dive into what we've done, you know, from same day discharge or decreased length of stay, and some of the, you know, hurdles from just, you know, the COVID time and the financial crisis that everyone had, how much this was instrumental. I mean, this was our answer. So I think that was a big driver for us, just to see how long our patients are waiting, you know, for an operation. I don't know if Alden, I know we looked at this, you know, during that time. This was, I think it was a big strike for all of us, and no one knew, till we started looking at it.
Absolutely. And just as a testament to patients wanting robotic assisted surgery, when we delivered our first DV5 at Tacoma General, we held a press interview and had an open house. And one of Dr. Rashidi's patients actually showed up to that open house because she was kind of on the fence. Does she want robotic surgery? And we actually let her play on the robot. And after that, she was totally convinced that, she knew that she wanted robotic assisted surgery. And what we know is that you can have great surgeons, but if they don't have the tools that can take them to the next level and allow them to do this great work, then it doesn't matter how skilled you are. You need the tools to accomplish the quality outcomes that we have.
Thanks, Dr. Rashidi. Thanks, Alden. And Matt, let me just give you an opportunity to weigh in here. Is there anything you'd like to add to what your colleagues have said so far, especially maybe as relates to the resource piece?
Yeah, that's the only thing I was going to comment on is that we have bottlenecks, right? Whether it's OR capacity or anesthesiologists, that what we found is that when we can optimize the space in the ORs, we're able to just do more with the same resources. And so we've seen that we've been able to incrementally add cases without adding new starts, without adding additional ORs. And so that's been the biggest aha moment that we've had. And it's helped so much with our financial recovery, is that to do more with less is what we've been really trying to do throughout the whole hospital. And the robots have helped us in the ORs and to do, well, our fixed costs and staffing are the same from an OR standpoint. We've been able to do more and grow our top line revenue.
Terrific. Well, Dr. Rashidi, I want to turn back to you again, because I think Alden and Matt are making clear the business case for the program. And I want to take a deeper dive, if you'll let us, into the surgeon experience, how this has played out and how it's spilled over and what you're hearing from the surgical team. Can you talk about this growth over the past 5 years or so as a surgeon leader? Are there more clinically focused remarks and experiences you can share with us?
Absolutely. I think, what happened, it drove interest and drove the collaboration between surgeons. I think the question is, what is possible in your market? I mean, colorectal was here, right? And at that time, and I feel it's just because, we got competitive market next to us. So if you look at Seattle region, you got the north side, which you got big hospitals, and they're great hospitals. You got Swedish, Virginia Mason, UW, and then you got the South, Puget Sound region, which is different hospital systems and including multi-care. So we had a lot of patient migration, to the north for the procedures, and they were doing more of a higher technology, procedures for their patients. And like I said, when you put the map, there was just so much opportunity from that market share. And we proved that a place, that was pretty much was in the, 1-digit % from that market share for that specialty, how much now we're actually the leading, market for colorectal. And that drove interest even within our, with other physicians and other surgeons. So we actually collaborated. And you see how this market share, we were like in the 5 percentile, and then how, during the years grew. And we have over 21% of that market share right now, which is pretty good. And it's growing. So what we did with this, as we started to grow, we're like, what else can you do? This is when you bring that collaboration and we're bringing others. So we were actually one of the first, there was one program and before us, but for our national accreditation rectal cancer program. So imagine a place that we were working on the colorectal. Now we're nationally accredited for our rectal cancer, procedures. And that is bringing all the physicians together. And then it grew the multi-specialty MIS surgery. So working with your GYN oncology, uro-oncology, plastic, so as these goes, it just starts to grow. And we saw a high increase, in our other specialties too. And it got others interested. And we'll dive more into how our general surgery grew faster, and acute care surgery, which was we're one of the programs who all the acute surgeons are certified to do Da Vinci surgery. So I think, from a surgeon perspective, when you start seeing the patient outcome, the growth, and that market share, you actually grow the other aspect of the program. And this is kind of like looking kind of, diving deep. These were the conversation, actually, it was good for myself to know, but also share it with our referrals, but also you can share with your patient, but most importantly, share with your hospital leadership. They needed to know what is the difference, right? What's happening? I mean, Matt and Alden are great, but I know they have so much else to do and take care of from a, whole institute standpoint. They're not interested to see, okay, what is my, length of stay? What is my SSI? I mean, they're interested, but they don't go that much, dive deep into it. So this, as a surgeon, I need to share that with them. Right. And this is what you, as a, if you're a surgeon out there, I would say collect your data, number one. And Intuitive has been great because with their MACA team, we're being able to collaborate and also get more from a bigger aspect. So you can see what the national, data could be, what, others. So we compared myself here, as you can see, compared to open and laparoscopic. And we looked at the cost saving. So you can see the average length of stay, for open and laparoscopic, 7 and 5 days compared to 1.8 days. I mean, that's a big cost saving besides what it does for the patient and the outcome, but that is cost saving for the hospital. So yes, robot might be an expensive tool, but when you look at the total cost of care, I am much cheaper with this tool. And I think that's important. And looking at other conversion, we all know conversions require thousands of dollars, If I had 0 conversion or my conversion rate is 1% compared to 16%, that again, how much you save the patient from the care you did, but also how much you save the hospital. So you can see on the right side, we looked at, our costs, estimated costs avoided, per procedure when we compare. These are over thousands of dollars compared to laparoscopic is over 12,000. And then how much you can avoid. And it's a huge thing. And I think this data is good, but I would say even if we look at the most recent data with the same day discharge that we do, it's even better. And then now you're looking into more detail of that cost avoidance. So when we looked at the direct cost, actually, I was very surprised when I saw the bigger picture, what's happening nationally and in Washington State. I mean, look how much our direct cost is, less compared to, what's happening, nationally and within the state. So that itself, I think it's important to share these, with your hospital leadership. So if you're asking for something, you have evidence to support why is this important? Why does it matter for your patient and how it can help the hospital from a financial standpoint, but also gaining that market share.
Thank you so much, Dr. Rashidi. I love the point, these might be serious investments, but they increase your affordability as a surgeon. Such an astute point. And Matt, that brings me to you, who can talk hopefully a bit more about some of the granularity around these investments. Can you speak about how you structured these acquisitions, especially given the financial constraints we so acknowledge at the top of our conversation? I just want to make sure we circle back to that reality and talk about how you as a CFO have been navigating these investments and decisions.
Absolutely. And first, Dr. Rashidi, I promise we do care about your metrics and your length of stay and other things. And so we do look at that. In addition,
I know, I was joking with you.
I know. I would say that, as we think about how we've expanded our fleet, we've had financial pressures, we've had negative margins, we've had capital constraints. And so I think one of the things that I want to call out, and going back to the point I made earlier, that how do we do more with the same fixed costs? But we added significant robots, right? So we added more robots, but we did that without adding capital. And so one of the things that I wanted to talk about was our AMP program. And so going from investing millions of dollars in a robot instead by paying per click, that's been a game changer for us. And thinking about the fleet expansion, we couldn't have expanded our fleet to the same level if we were purchasing each unit on a per unit basis. And so this has been really helpful for us to go to a per click basis, and has helped us in our especially given the last couple of years of financial challenge. And so I just wanted to call out the per click basis being a game changer.
Thanks, Matt. I'm going to turn to you, Alden, for your initial thoughts on the next question I have, and that is the data, right? I think we mentioned at the top, the data that informed where these investments would be made, how you carry the gains and the benefits and the results you've seen to other specialties within Tacoma General. Can you speak about this? How has the data-driven approach to such programmatic growth evolved, and what's been the most important?
Absolutely. Thank you. So if we go back to the slide showing the colorectal market share growth, as I mentioned earlier, we've really been able to partner with Intuitive. They have a very robust data set. They have robots in almost every hospital in the country. And so not only do we get data from our own sources, but we also have the data of what's actually happening in the market nationally, regionally, and then locally to the state. And so we identified that we had an opportunity, particularly in colorectal surgery, as many of our other specialties. And what I like about our colorectal program is we went in 2018 to 2019 to performing colorectal surgery to really having a world-class colorectal program. And that's really been a testament to the work that Dr. Rashidi has been able to do around all of our national accreditations, and she can name all of them. They're more than I can name. But it's inspired our other specialists to achieve the same for their own specialties. And so it's really changed the culture of our surgical staff and really wanting to achieve higher levels of quality outcomes, volumes, and access to the robotic platform. And particularly, Matt, as we engaged with the AMP program, there was a per click cost. And so we were able to, really get down to the nuts and bolts. How much additional expense are we going to have to perform robotic surgery through the AMP program? And so Dr. Rashidi actually changed my entire perspective. And if there's executives out there, instead of saying, well, you can't perform, hernias on the robot because it just doesn't make financial sense, the question or the directive is, if you want to perform hernias on the robotic platform, then these are the metrics that you need to meet. And so that really just changed our perspective. And, working with Intuitive, they're able to benchmark all of our surgeons on cost of care, instruments used, time in the OR, all of our different expenses that go into the overall case. It's really helped us dial in our contribution margin per procedure and help our other surgeons achieve where Dr. Rashidi is in colorectal surgery, Doug Sutherland for urology procedures. And really that's cascaded through all of our specialties. And we now have surgeon champions for robotic surgery in almost every specialty. And one of the things that I really like is that the culture that we've created, I keep going back to culture, we truly do have a great surgeon administration partnership. We had one of our in-market, another market share opportunity growth for us. We had an in-market thoracic robotic surgeon, very prominent in the community, receive referrals from all over the state, leave the market. And a year later, he chose to come back and work at TG instead of his prior employer. And so we're really using our robotic platform, our engagement and alignment with our surgeons to build high quality, cost-effective care and multi-care.
Thanks, Alden. Dr. Rashidi, your name came up a couple times there in those remarks. Anything you wanted to add to what Alden had just shared?
Alden is very nice. No, I'm joking. But and one additional thing I wanted to ask, to state is, like he mentioned, how we're attracting, better surgeons and because of the program that we build. I would say I'll advance that. Because of building I told you, when you build a program, you build around it. So we actually started a fellowship program, Advanced GI / Minimal Invasive Surgery program, which is more focused on actually robotic surgery. And I would tell you, it was our first the second year when we went to the application process, we had one of the highest applicant member. And main reason was everyone who came for an interview, they said, we heard you guys have a very strong, robotic program. We want to get trained there. And our program became very well known for this reason. So that kind of is a testament that, yes, you're growing the market, you're growing other, from a surgical volume, but there's other things that come with it, with education, research. And that's what we have actually been able to grow at the same level as we're growing our market share and taking care of our patients.
Sure. Oh. Thank you so much. And Matt, I understand too, when we're speaking about some specific procedures moving to minimally invasive, I understand too that there was a noticeable improvement with doing so for hernia, right? Can you speak to in some detail to this change?
Yeah, this has been we've looked, and so we do this kind of the review of what the options are as far as the margin on different cases and how we're reimbursed and what our cost is. And so we did see the minimally invasive hernias have a significant revenue impact, and so that resulted in more contribution margin in total and per case. And so I would say, one of the things that we do that analysis of how we grow our market share, it's also looking to, it's a couple different factors of one, increasing the size of the pie, right? So doing more procedures, but also looking on a per procedure basis. What's the difference between the different modalities of laparoscopic or robotically assisted? And so in the case of hernias, you can see we had a significant improvement in our payment and our contribution margin. And so we've moved to doing more minimally invasive of these type of procedures and have seen a significant revenue growth due to that change.
Really helpful to see this in the specifics. And Alden, I'm going to turn to you because I believe there's a similar story to be told here about hysterectomies. Is that right?
Absolutely. And so you can look on this slide here, we avoided 158 conversions in hysterectomy. So again, back to Dr. Rashidi's point, when you convert to open, length of stay goes up, complications go up, cost increases, poor outcomes for our patients. And so we've really been able to partner with our gynae surgeons to convert more and more of their cases to the robotic platform. And really, we have Dr. Amir Azari and Dr. Masri, who really have embraced the robotic program and very similar to Dr. Rashidi, want to achieve and continue to improve their outcomes. And you can just see on the right-hand bar graph, average length of stay for a robotic approach in hysterectomy is 0.6. And what we've really been able to leverage through performing robotic surgery is actually pushing some of the lower acuity cases out of Tacoma General, which is our tertiary referral center, to our ASCs. So I mentioned earlier, we have 4 total operating sites. 2 of those are ASCs, and both of them are hospital-based, which means we get hospital rate reimbursement, which keeps my buddy Matt very happy. And so what we've been able to do is still offer robotic surgery to our surgeons and our patients, but in a lower cost site. And it's really improved our overall outcomes. We've reduced complications, and really that's our goal for 2024 is how can we continue to decant the TGORs, which is really set up for the highest acuity of patients, and really start performing those lower acuity cases in the ASC settings, which we know both our surgeons and our patients enjoy.
Thanks, Alden. I appreciate hearing the names of different surgical leaders in the program. And there's another name that's popped up a few times now, and that is the DV5, right? The newest member of your team and your program. Multicare Tacoma General is at the forefront of technology innovation, one of the first sites to acquire the newest Da Vinci system. And I anticipate that this decision took some careful financial and strategic planning. Can you walk us through the value you see in the newest system and how it aligns with your strategic vision right now for the program?
And I'll turn it over to Matt to really talk about how we did the cost analysis and the efficiency gain, which offset the overall increase.
Yeah, so we did look at a contribution margin per case, and with the cost changes, what that did. I think that when we looked, it was about growing our market share and increasing our surgeon recruitment and retention. And so we did maintain a positive market share with the DV5. And we also looked at where there was opportunity. So if we were bringing down the total time in the OR per case by, I think 17 minutes was the turnaround time saved on a per case basis. How did that increase our ability to, again, do more in the same limited resource of our ORs? And so we did the math and looked at contribution margin per case. And again, that remained positive. We also looked at where there was potentially some duplication of cost. And so with the DV5, there's an integrated insufflation, energy, smoke evacuation, and other elements that are all built in. And so we looked at where there was duplication. And so there's hundreds of thousands of dollars of savings with these units that we also looked at as an offset. And so overall, I would say that we did the math, one, to make sure that growth was there, and that it was positive contribution margin growth. That checked the boxes. Then we looked from a strategy standpoint, and I think Dr. Rashidi and Alden can also speak to this, but we looked from how to be a leader in the market, and what that could do for MultiCare and for Tacoma General, to be an early adopter. And I really think this is the next level. And so it worked from my math standpoint, but also really fit well with our strategic growth that we had planned as well.
If it's okay, I like to add, I really like to give a shout out to our, hospital leadership exec, Matt's, Alden's, Eddie's, for, when we just started discussing, from a surgeon perspective, because I think for them, it's important, like we talked about, what is the right tool for your surgeon and how is it going to help the OR team and the patients? And, we had these discussions to talk about what are the differences. We went through every single difference, as far as between the previous, model and the new Da Vinci 5, and how that integration, having all the instrumentation, can help the OR itself, from a staff perspective. So you need less staff. You can actually direct those staffs to other places. So it's a saving. It saves time. We've seen shorter time for our OR staff because everything is in one versus get your laparoscope tower here, get your, pneumoinsufflation tower here, have this here. So, the staff have that integration form that they can control. It builds up the confidence in the staff because you got so many tools like guided tool exchange, things that are more detailed. But when it gets detailed, sometimes the leadership is like, okay, what are you talking about? And I'll give credit to Eddie and, for coming, down to Sunnyvale and showing him before, all Alden, Matt's, everyone were speaking, but there was a representative that came in, who's our president of the hospital, and came and saw in person, what are the values? When you see it and you see, okay, it's going to help the OR staff, it's going to increase efficiency. It has helped me to decrease my operative time because as a surgeon, now I control everything. I don't have to keep asking, do this, do that, get my head out. Everything is in that head and console, as we say. So that has helped. And the tactile feedback, I'm a big believer, do less trauma, with your operation to get the best outcome. Now you can assess how good of a surgeon are you? So I feel those are the aspects, that was important from a surgeon perspective. But we actually, as a team, when Chris Hunt, the head of the operation for the OR, we went to Sunnyvale and we showed it. And, once they saw it, they're like, makes sense. And then, of course, comes the market share and being one of the first sites and, what it can do. So I think those are very important when hospital, the relationship between the surgeon and the hospital leadership of how we can understand each other and work toward a common goal.
So important. I'm glad you added that, Dr. Rashidi. And I think that leads me to really my final question, which is just looking ahead. It sounds like there's so much momentum at MultiCare right now between the culture you all have illustrated, the cooperation, collaboration between your distinct stakeholder concerns, how I think, Dr. Rashidi, there's a great amount of respect for what might be the primary concerns of each group, operations, finance, and surgeons, of course. And then the quality, financial, and operational metrics you pointed to. What do you see as the next steps you can point to? What should we anticipate from MultiCare next?
Well, we're growing, we're innovating. So we are one of the innovator sites. We did the FDA trial for our single port for colorectal. Actually, that opened up the door, for our, brought the knowledge again, that education. Now, one of our really great, urology, oncology surgeons, Dr. Sutherland and his partner are using the single port, for their urologic, test. We're pushing the limits with acute care. We do it for colorectal. Now our acute care surgeons, are on it and operating. We're doing a lot of research. We're one of the first sites in the United States doing same-day discharge colectomies. So we're pushing the limits, it's not just stop there. How can we innovate? How can we advance? And having a great support from your hospital leadership and having surgeons that want to, grow, I think that's where the best outcome for the patient and innovation comes. Mm-hmm. And definitely working with, your, partners. I would say Intuitive has been a great partner for us, and none of this, we all need each other. And it's very important between, the industry, the healthcare from a hospital, the surgeons, to work together.
Well, thank you, Dr. Rashidi. I think all of that, I would love any remarks from you, especially as it relates to pipeline. I hear so many health systems talking about talent pipelines. How has the program and its development spilled over to affect what you see as the pipeline progress and also where things stand today?
Absolutely. So as I mentioned, the first component you need to building a robotic program is having extremely talented surgeons and then giving them the tools. And so what we've been able to do is actually change our culture. We actually had one of our subspecialty programs where we ended up separating from some of our surgeons because we didn't have the outcomes that we were looking for. And we went from hiring warm bodies to truly hand-picking. Dr. Rashidi going to national conferences and people saying, hey, can I come work with you? Not just in colorectal surgery, but in all specialties. It's really expanded our physician recruiting platform and pipelines, which, as we all know, is extremely expensive and challenging. And so as really great surgeons, as they're engaged, they don't want to leave their current practice. So how do we become more attractive to those surgeons? So it's been great for us overall from our culture and then our recruiting and retention of high quality surgeons.
That's huge. And Matt, I wanted to check in with you too about capacity. There's been a lot of remarks about turnaround times, the same amount of resources, but doing more with them. Any capacity plans you can point to for our audience that they can keep an eye out for MultiCare?
Yeah, definitely some exciting news that is part of my role is the Mary Bridge Children's Hospital is currently located within the same walls as our Tacoma General Hospital, but we're in process now of building a new children's hospital across the street, which is going to open in early 2026. And so thinking about what that looks like in the future, we have instant capacity in our Tacoma General Hospital. So they're currently occupying 6 of our ORs. When we talk about with Dr. Rashidi and Alden, we're talking about pipeline and recruiting talent and how we're going to grow. I'm thinking about how we're going to grow to backfill those open 6 ORs that we're going to have in now less than 2 years. And so that's exciting to think about. And it's been a really fun project to be a part of, and look forward to how Da Vinci can be a part of that strategy to grow and expand. And we're going to need to grow market share as we expand our OR capacity. So exciting times.
Fantastic. Well, let's check in. We have a couple questions here from our audience that I would love to elevate and give each of you the opportunity to answer. I think, Alden, this first one is for you and Dr. Rashidi, and that is, You showed the long wait times for colorectal procedures. How did those times and those wait times change after increasing access to robotics?
Do you want me to go out then, or?
Yeah, you go first.
Well, it was a huge change. Because we have, the accreditation program and we're really trying to grow. Actually, the cut down now we are able to max is 2 to 3 weeks, max. We're talking about from a cancer perspective or more urgent emergent, cases for benign disease. I would say we have been able to actually see the patient and get them in within even a day or two or the week after if it's more emergent. So I think we did not have that capability a couple of years ago. Actually, our patient who came to test drive the robot the other day, they asked the question and she said, I've never seen something happen so quick. She's like, I got diagnosed 2 weeks ago. I was seen in the clinic the week after, and I am scheduled this Tuesday for my surgery. So literally within the time of diagnosis to time of operation was total of 3 weeks. That's pretty awesome, if you can do that. I mean, our goal is to be even that 1 week, but we have to, be realistic as well. But there's been a huge change and patients are much more happier and the satisfaction rate from the patients are much higher just because you can attend to their problem much faster.
Absolutely. I would agree with Dr. Rashidi. I would also add that, we've been working to match our robotic access to our surgeons' next available procedure so that we can truly give the option, the earliest option to our patients for robotic assisted surgery. And, going back to the AMP program, we've had a capital free investment through the AMP program to be able to bring those robots to our ORs. And as I mentioned earlier, getting those robot out of our main TG, out of our main ORs, get them to the lower acuity ASC settings to just continue to expand that access. Our ultimate goal with our ACS surgeons, so it's our acute care surgeons, they take our trauma call, is to have same day access for robotic assisted surgery for emergent cases. And we're already on that path, and we'll achieve that by the end of 2024.
I think, Alden, you might have just hit on the next question I was going to turn to from the audience. Does your hospital offer robotics for acute care?
Absolutely. So all of our acute care surgeons are trained on the robotic approach. And so that's our goal, right? That's our next big specialty. We've already reviewed all the data about open in lab and the cost savings. And so now we need to work on our efficiencies and getting our robotic surgeons the tools and education they need to become efficient so that ultimately we can provide high quality, lower cost care. It's actually been incredibly helpful just talking about multi-care and how robotic surgery has put us on the map. We had a group of 5 ACS surgeons leave a community group and want to come work only at TG because of the access to robotics, the way we interact with our surgeons, the engagement and the ability that they have to truly impact the way that we operate our ORs. And so it's been a great story. I'm looking forward to the data as we continue through 2024 because I think it's the next phase of robotic surgery.
Alden, Dr. Rashidi, Matt, I want to thank each of you for joining me today, sharing your story. I think you pointed to a lot of quantitative data, some evidence for us and as your audience to study and learn from, and also some really great storytelling, some anecdotes that just support all the points that you hit on so wonderfully. So I want to thank you very much for sharing your message and experience with us today.
Thank you.
Thank you.
Thanks for having us.
Thank you.